Bob, there's another book that you've written, which maybe you could explain to me a little bit more about it, because it's still as part of your translating strategy into action. It's called Time-Driven Activity-Based Costing.
What's another theme of my work that I've been doing for over 25 years, and how to measure costs more accurately. And before I got working on this, it turned out companies actually didn't know what their products or services cost. They had misapplied a lot of overhead costs.
Really? I would have thought that's the first thing on their mind, you know.
Well, I would have thought so too. I was surprised how badly the systems were working. And fortunately, we were able to find an approach to improve that so they can measure accurately down at the individual product or even the individual customer level what the profit and loss is. But this has been a big new area of mine for the last 3 years, because about 3 years ago I got a call from my strategy colleague Michael Porter, and Mike saying that he's been working in healthcare. And the healthcare sector in the United States, ironically, is a sick sector. You know, we're spending 18% of our GDP on healthcare, and our people are less healthy than those in many other countries. And it's just a huge, out-of-control costs. And I knew Michael was working on this, but didn't know all the details. And he said he had a certain approach, which is we have to get healthcare organizations to compete on the value that they deliver to the patients. And the value is defined by giving them better outcomes from treating them. But he says we also have to know what it costs us to achieve those outcomes. So he was very involved in how to measure outcomes by clinical condition, but he said no hospital or clinic that I work with seems to know what it costs them to deliver care. And he says, do you know where I should look? And I said, well, Michael, I've looked at this a little bit, and your observations are true. They are mismeasuring their costs terribly, but I think I know how to do this. And he said, well, would you like to work with me on this? And I said, sure. And so we started to work with a number of leading hospitals in the US and abroad, and to apply a time-driven, activity-based costing approach to them. And it really does work. And it's just going to change the way we actually deliver and reimburse for health care, because right now we're paying hospitals and physicians for doing procedures, whether it's needed or not. And we pay for tests, and we pay for x-rays or MRIs, and each time you get one of that, the cash register is clicking. And so the approach that Michael and I are taking is we're going to pay you actually for the outcomes. And that's treating a patient for a clinical condition, and we're going to design the payment so that it's above the cost if you're doing things efficiently, and that's where I come in. And it sounds simple, but just it's a radical change. And we think if we do this, we'll be able to get dramatic improvements both in the outcomes that providers deliver, and they will deliver it at much lower cost. So it's a very exciting project.
But other than the healthcare, I mean, have you seen companies actually, saving on their costs?
Oh, absolutely. Because when you do this, they sometimes they'll find that only 20% of their customers are really profitable. I mean, the rest are either about break even or lose money, and they never saw it down at that level of detail. And once they see, where are the unprofitable customers or where are the unprofitable products, that doesn't mean you drop them, but you understand why are we losing money, and you can take actions to redesign that. You can either reprice it or change the way you package and deliver. I mean, once we give them the data, then the managers start to work and improve, and that's the same thing in the hospital.
Okay, great. And of course it's important because at the end of the day they might find that they can actually make more profits if they save on the cost.
Absolutely.
To begin with.
Yeah.
Okay, well.
My institution, Bank Indonesia, already used this system from like 2003. Yeah, and we're adapting it to our culture. Yes, and Balance Scorecard is making us able to plan ahead better and know how successful we have become from year to year.
In a nutshell, Bob, what is the execution premium?
Well, we said at the beginning that 80% of companies fail to achieve the targets in their strategy. The execution premium is the premium that successful companies earn when they actually do implement their strategies well. And then they're like mobile, where you go from the least profitable to the most profitable in 2 years and sustain industry leadership into the future.
Great. Well, thanks for sharing this. So what's next? What's in the pipeline for you?
Well, some of these aspects of, and this is things I'm just thinking of, that on the social engagement with business. So my colleague Michael Porter wrote about shared value, how companies should be working in their communities to create value. And the shared value is the company still makes a profit, but there's value added to the community. And I actually think that we can describe a shared value strategy using a balanced scorecard.
Good. Well, thank you very much. I hope we have some practical, things come out of that meeting to be sure, like you say, the proof of the pudding at the end of the day is, well, the proof is in the pudding,
The Hall of Fame.
Yeah.
Breakthrough performance using
Fame.
this approach,
Yes,
and earning that execution
well,
premium.
thank you very much, Professor. It's been great to have you, and I'm certainly looking forward to reading your book, The Execution Premium, Linking Strategy to Operations for Competitive Advantage.
Okay, well, thank you, Daisy.
Thank you. What have I learned from my conversation with Robert S. Kaplan? Well, having a vision, understanding risks, and having good communication skills, these are essential elements of good leadership. And yet, for a company to succeed in an increasingly competitive world, it's important to have that ability to align company strategies with their execution and the ability to measure the company's performance. And that's all for tonight's episode. Don't forget to join me next month where we meet another person who makes a difference to our lives here on Face to Face with Daisy Anwar, bringing you the world.